This is how the patient is going to be presented on the day of surgery. So the first thing that we're going to do after we numb the patient is that we're going to be extracting the molar right here, the two premolars right here on the right quadrant, the premolar remaining root on the left quadrant right there. And then we're going to be starting by flapping the patient. So once we flap the patient, this molar right here, this impacted soft tissue molar, is actually going to be in the way of the guide and it's seating, so that has to go. This is very, very important. Once the extractions are done, you're going to be using this right now, so you'll be having some of the teeth still in position, and you will have, of course, the bone. So in order to seat that, what are you going to do? First of all, after you flap the patient, you place the bone reduction guide inside the patient's mouth. Once the bone reduction guide has been placed, you go ahead and you use the teeth and bone pin positioning guide. Of course, you can see how it's seated right there into the bone, and with resting over that premolar right here and that central incisor right there as well. With that, you're all done with the pin positioning guide. Okay, after that is done, you can go ahead and remove that PPG. With that, you can extract the remaining teeth, and this is how it's going to look. So you're actually all okay to either use the other pin positioning guide that is completely bone supported to use right there. So that's one of the ways that you can do it. Or if you don't want to be using that second pin positioning guide, at least you have it as a second set for safety, right? And once that is done, you go ahead and you reduce the bone according to that plane. Once the bone has been reduced, you're all good to go to place on your implant surgical guide. And once the implant surgical guide is there, you're all good to put on your drills to actually start your osteotomies and place your implants. Once you're done with that, you're all good to go to remove that implant surgical guide, put on your multi-unit abutments. Once you're done and all good, you're all okay to actually remove that bone reduction guide, and you can go ahead at that point and put on your wax up, okay, or actually PMMA, and that's going to be the space that you're going to have to suture around and work with the tissues all around.